name is Matea McPherson, and I'll be focusing on prescription drug abuse. Have you ever experienced prescription drug abuse or know somebody who has? You'll be surprised by the statistics I have unraveled over the course of my research. According to Nationwide Trends Drug Facts, an estimated amount of 24.6 million Americans are abusing a drug on a daily basis. Of these, about 6.5 million are abusing drugs that are prescribed. Statistics from Get the Facts Prescription Drug Abuse on College Campuses says that about 1 in 4 college-age students have reported to abusing prescription medications at least once in their lives. This is important because prescription drug abuse has become a normality in the United States and has taken a huge toll over the nation. I will discuss the most commonly abused categories of prescription drug abuse, which are opioids, CNS depressants, and stimulants. I will first begin with the opioid category as it is the most common. Opioids are synthesized in labs to mimic the opium poppy plant. They are used to affect brain receptors, allowing individuals to tolerate pain and control emotions, commonly prescribed before and after surgery. According to an article by Longo, Volkow, and McClellan, using opioids long-term require increasingly higher doses to maintain the original level. Up to 10 times the original dose can be prescribed. According to What Are Opioids, an addiction can occur within 6 weeks using legal forms such as codeine, OxyContin, fentanyl, Percocet, Vicodin, and morphine. Now that we have discussed opioids, I will begin discussing the CNS depressant category. CNS depressants are divided into 2 categories. They include barbiturates and benzodiazepines. Barbiturates treat seizure disorders and help patients cope with pain and depression after surgical procedures. When abused, the user may undergo an altered level of consciousness, difficulty thinking, and experience drowsiness and slowness of speech. According to Barbiturate Intoxication and Overdose Medline Plus Medical Encyclopedia, coma, memory loss, or even death can result from abusing these drugs. Meanwhile, benzodiazepines are used to treat smaller disorders such as stress, panic attacks, convulsions, and sleep disorders. Long-term use can result in trouble learning, verbally, visually, and processing information. Now that I've covered the CNS depressants, I will move on to my final category of stimulants. Stimulant drugs speed up the activity in the body. They can be used to treat narcolepsy and attention deficit hyperactivity disorder that keeps individuals focused on their tasks. Stimulants can increase blood pressure and heart rate, constrict blood vessels, increase blood glucose, and increase the rate of breathing. Abusing these can result in very high body temperatures, irregular heartbeat, heart attacks, and lethal seizures. An article by Locken and Kirchkissner gave some examples of stimulants, which include Ritalin, Concerta, and Adderall. Today I have discussed the 3 categories of commonly abused prescription drugs. They include opioids, stimulants, and CNS depressants. This information is valuable because of an increasing and alarming rate of abuse, overdose, and addiction. In order to ensure a better and safer future, we need to decrease the amount of drug abuse and get those already affected help. Thank you.